two people take the same drug, one gets cured and one doesn't. What's the difference? Absorption. Because in pharmacology, absorption decides everything. Lipid-soluble drugs absorb faster because biological membrane are lipid in nature. So drugs with high lipid-water partition coefficient crosses easily. Now, in oral absorption, most drugs are absorbed from the intestine rather than the stomach because the intestine has much larger surface area, making the absorption faster. Now, drugs must dissolve before absorption. So, smaller particle size increases the dissolution and speeds up the absorption. Now comes the food effect. The food reduces the drug absorption because it delays gastric emptying time and can form complexes like tetracycline binding with the calcium in milk, which decreases its absorption. Now, the oral expectations. Highly ionized drugs like streptomycin and neostigmine are poorly absorbed orally because it's ionized and it cannot cross the lipid membrane effectively. Now, some drugs are destroyed in gastrointestinal tract, such as penicillin G, it's destroyed by gastric acid, and insulin by peptidase, making them ineffective when they are taken orally. Now comes the formulation support. Formulation like enteric coating protect drugs from gastric acid, while sustained release preparation slow drug release and prolong their action. Now, intramuscular injection. Intramuscular injections are absorbed faster than subcutaneous ones because the blood flow. It has higher vascularity that increases the drug uptake. Increased blood flow, such as during heat or exercise, it enhances the absorption, while vasoconstriction by agents like adrenaline reduces it by decreasing perfusion. Now, large molecules that cannot easily cross capillaries are absorbed through lymphatics, as seen with depot preparation. Now, the topical absorption. Topical absorption depends on lipid solubility because the skin acts as lipid barrier, allowing the drugs like nitroglycerin and clonidine to pass. Now, absorption increases when the skin is hydrated or damaged, such as with occlusive dressings or abraded surfaces, because permeability increases. Now, topical expectations. Some substances like organophosphate insecticides can be absorbed through the skin and can cause systemic toxicity. Damaged skin can allow dangerous absorption, such as tannic acid, causing hepatic necrosis when applied over burns. Drug transfer through contact can affect others. Listerine cream causing gynecomastia in male partner. Now, corneal absorption depends on ionization, where less ionized drugs like physostigmine can pass. Highly ionized ones like neostigmine cannot. Now, remember, absorption depends upon solubility, surface area, blood flow, and route. This one small factor changed the game. That's all for the day. Thank you for listening.